എനിക്ക് ഈ മഹാപ്രതിഭയെ പറ്റി ഇന്നൊരിക്കലും നേരിട്ട് കാണാൻ അവസരം ഉണ്ടായിട്ടില്ല. ഈ വ്യക്തിയെ പറ്റിയുള്ള ലെക്ചറാണ്. എൻ്റെ പേരും കൂടെ കണ്ടപ്പോൾ എൻ്റെ ഒരു സുഹൃത്ത് എന്ന് ഞാൻ അഭിമാനപൂർവ്വം പറയുന്ന, എനിക്ക് ഒരുപാട് ബഹുമാനമുള്ള വ്യക്തിയാണ് എഴുത്തുകാരൻ ശ്രീ അരവിന്ദാക്ഷൻ, തൃശ്ശൂരുള്ളത്. ഇദ്ദേഹം മാർക്സിയൻ തോട്ടാണ് അദ്ദേഹത്തെ കൂടുതൽ സ്വാധീനിച്ചതെങ്കിൽ ഗാന്ധിയൻ തോട്ട് കൂടുതൽ സ്വാധീനിച്ച ആളാണ് അരവിന്ദാക്ഷൻ. പക്ഷേ ഈ പേര് രണ്ടും കൂടെ കണ്ടപ്പോൾ അദ്ദേഹം ഒരു വാട്സാപ്പ് മെസ്സേജ് ഇന്നലെ അയച്ചു. ടി കെ രാമേന്ദ്രൻ ഒരു വലിയ പ്രതിഭാശാലിയാണ്. കേരളത്തിൻ്റെ ദക്ഷിണാമണ്ഡലത്തിലുണ്ടായിട്ടുള്ള ശക്തരായ ഒരുപാട് ശിഷ്യഗണങ്ങൾ ഉണ്ടായിരുന്നു അദ്ദേഹത്തിന്. മനുഷ്യവർഗത്തിൻ്റെ മോചനം മാത്രമല്ല, ഭൂമിയുടെയും അതിലുള്ള എല്ലാ ജീവജാലങ്ങളുടെയും ആകെ മോചനം സാധ്യമാകും എന്നാണ് അദ്ദേഹത്തിൻ്റെ ചിന്തകളിൽ നിന്ന് എനിക്ക് തോന്നിയിട്ടുള്ളത്. അപ്പോൾ എത്രത്തോളം അദ്ദേഹത്തിൻ്റെ സ്വാധീനം ആരിലൊക്കെ ചെലുത്തിയിരുന്നു എന്നുള്ളത് വളരെ വ്യക്തമാണ്. ആ ഒരു സരണിയിൽ എവിടെയോ വന്ന് ഒരു കണ്ണിയാവാൻ എനിക്ക് അവസരം കിട്ടിയത് എൻ്റെ ഭാഗ്യം. ബിഫോർ ഐ സ്റ്റാർട്ട് ഓൺ മൈ സബ്ജക്റ്റ്, ലെറ്റ് us be clear about one thing. Palliative care is not only about the dying. ഇവിടെ കുറച്ച് പേര് എൻ്റെ കൂടെ വളരെ കാലം പ്രവർത്തിച്ചിട്ടുള്ളവരുണ്ട്. അപ്പോൾ ഞങ്ങളൊക്കെ അന്നു മുതലേ പറയുന്നതും ഇപ്പോഴും പറയുന്നതും ഇത് മരണത്തോടടുക്കുമ്പോൾ മാത്രം ചെയ്യാനുള്ള കാര്യമല്ല. ഞാനത് പറയുന്നത് ഇന്ന് മരണത്തിനോടടുത്ത കാര്യങ്ങളാണ് പറയാൻ പോകുന്നത്. അതുകൊണ്ട് ജസ്റ്റ് ക്ലാരിഫയിങ് ദാറ്റ് ദിസ് ഈസ് നോട്ട് ഓൺലി അബൌട്ട് ഡൈയിങ്. വെൻ ഷുഡ് സംബഡി ഗെറ്റ് പാലിയേറ്റീവ് കെയർ? The world has no lack of clarity about it in those circles, but very often it is much too associated with dying. In India, the duty of the healthcare professional is defined, I will come to that, as to mitigate suffering, to cure sometimes, relieve often, and to comfort always. There exists no exception to this rule. There exists no exception to the rule that you and I have a responsibility to mitigate suffering. So, when would you give me palliative care? When my suffering starts, which may be even before a diagnosis is established. And then I know that cannot be done by referring you to a palliative care physician, but let us hope for something that already the world knows. World Health Organization says integration of palliative care into all healthcare. A world where every healthcare provider, physician, nurse, physiotherapist, pharmacist, everybody understands the principles of palliative care and uses it, integrates it into his or her care program. If you think that's an ideal dream, many things are happening already. In 2017, World National Health Policy includes palliative care. In 2019, MBBS curriculum has already included it. 2021, BSc Nursing course has included it. Implementation gap will be fairly long. In all our countries like India, low and middle income countries, implementation gap will be there. That's where our facilitation is important, and therefore this group, the group who thinks, thought leaders, understanding that and facilitating that is very essential, because as we go along, we will explain what Ashokan taught us at one point of time, that the people are important, that we must consider the person and not only a disease. With that, making sure that that's clear, I am going on to that part of palliative care which is to deal with the time close to death, because that is one area. As I proceed, I will explain why that is particularly becoming important and why something has to be done about it. Apologies for the question. Can I ask for a show of hands? I know there are some very young people also here. It may be a bit of a cruel question to some people, but to the young and old, I still ask the question. Are you able to think about your own death? If yes, can I have a show of hands? Very unusual group. Thank you very much. Very unusual group because about 50% of hands went up. I know some hands will not go up. Some hands will be having some tremors to see whether it should go up or down, because that is natural. Because this is a group of more of thinkers, there are more hands going up. And possibly also because the older generation is more here. When I was a child, death was very visible. We would see cattle in the shed dying, we would see elders dying, we would see uncles, aunts, everybody dying, and we were not shooed away. A few years back, I went to the home of one of my colleagues, one of my teachers who later became colleagues, and his son-in-law was close to death. And I saw his son about 15 or 16 years, very busy packing and stuffing notebooks and textbooks into a school bag. He was being sent away so that the father's death does not interfere with his studies. Studies are important. If in 12th class marks are not good, performance is not good, it's a big problem. That father and son, the father died in an ICU without seeing that son once more. How much of scars will be there in that boy's mind? Will they ever, or wounds which will never heal? Somewhere we have lost some balance, and I think it's a great strength to be able to think about your own death. To the owners of the hands that did not go up, while I wish you immortality, nevertheless, if for those who accept that they are mortal, generally would find it easier to give more meaning to their lives. We will know what is more important and what is less important. Some of the things that we madly rush after, if you step back and think, is that really important in the long run? So I think it's important to be able to think about your own death and your loved one's death, because we are at risk. If we don't think about it, we are at risk. Can I have some help here? I am unable to move the slide. So being able to accept one's own mortality helps us to value life and live meaningfully. Help others who are facing death, which would be our loved ones also, and die as well as possible. Dr. Sankha Mitra is a British oncologist of Bengali origin. In the last 20 years, he traveled to the Northeast fairly frequently and did charity work, a lot of charity work. And then he made this statement: in India, the poor die in misery and neglect. The middle class die in misery of ignorance. The rich die in misery on ventilators. No one gets a pain-free and dignified death. No one may be an exaggeration, but it's not too much of an exaggeration, because not many in India, maybe less than 4% get a decent death. This is a particularly Indian disease. There are 3 classes there: neglect, ignorance, on ventilators. Which is better? Which is worse? I'm an anesthetist by training. I have worked as an intensivist for a long time. Please be clear that I am not saying that all intensive care is bad, by no means. What intensive care does is, when you are seriously ill, it monitors every one of your important organs. Because if one malfunctions, that malfunction destroys others also. If your heart does not function properly suboptimally for some time, your kidney would get damaged. Intensive care makes sure that it's monitored from minute to minute. Intervention happens then. Recovery is facilitated. But that is valid only when recovery is possible. Sometimes you don't know. You have to try anyway. That's fine. But when you know that there is no reasonable chance of return to a reasonably normal life, what would you choose? I have no doubt about it. I know that intensive care can be valuable, and I would have loved to have it if that was the situation, but when I am going, I know it will only add misery. There's a tube in every orifice. There's no difference between day and night, Mohan. It's this light all through. Every patient has at least one monitor. So in a room there will be so many bleeps all the time. And we do not see human beings. We see masked aliens walking around us. No human contact. My family will be allowed for 5 minutes in the morning, 5 minutes in the evening. Then they are afraid to touch me because my body is covered with cables. Sometimes you touch and then an alarm goes on. It's a lonely kind of hell. Rigorous imprisonment till death. This woman, we were seeing her in a poor home. She had a daughter who did not even have enough money to feed her children and to come over to see her. We had to send her. She would cling to anyone who sees it. Here, this embrace to anyone whose face shows compassion. She needed that human contact. That's one of our volunteers. He's no more. Very valued volunteers by name Mr. Rajagopal. But we sent the daughter some money so that a neighbor could feed the children and she could pay for the bus. She came over. Whenever I went to saw her, the daughter would be sitting at the head with a hand on the forehead of the mother. For those 3 days, they connected. And she died with a few drops of water going down the throat. My God, what luxury! You and I are unlikely to get it unless we are very careful. You will get only a suction catheter, not water. Let us think about what would be important. For me, a hand to hold is very important. I may get scared. I will say, okay, I am able to think about it. I have seen death all the time, but at that time I know that my mind will be not the mind that I have now. I may be scared. I want somebody's hand to hold on to. And I would consider myself very lucky if at that time I can get a kiss on the cheek from my granddaughter. Those are things that matter. The most important things to oneself at that time are stolen from us systematically. And instead, suffering is added. I hope none of the doctors is angry with me for saying this. But, oh my God, this is the most important thing for me for the future. And I say this is a particularly Indian disease. I have data. The first panel shows Europe. This study was done in Western European Union countries. And in those 1919 to 2016 data showed that almost 90% of people, 89.6%, in the ICU, when the disease was considered terminal, when a return to reasonable quality of life was not expected, they were taken out of life support systems and instead given palliative care. 89.6%. See the Indian figures, that's also recent, 2021. Dr. Mani, who published this, is considered possibly the doyen of critical care in India. And he and colleagues published this, which shows that 70% of people in the similar situation died on life support systems, their deaths being stretched out over days or weeks, destroying the family also. The other 30% wouldn't have got palliative care, right? So they had another rather cruel way of treatment. That happens generally when the son initially comes and says, expense doesn't matter, save my dad. And after a week will come and say, Dr. Geeta, I have nothing left. Even if I sell myself and my kids, I cannot get any more money. Please send him home. 30% of people are discharged like that without palliative care, usually put in an ambulance, sometimes with an ambu bag, asking the wife to squeeze it 12 times a minute. What a cruelty. So, generally, the situation is cruel. I am sure I am not exaggerating. This transition happened in the last 25 years. It didn't happen earlier. I am saying because I am an intensivist. We used to treat patients in the ICU who could be brought back to life. There was a reasonable chance. It's not always possible. Some people would still die on the life support systems, but only when that doubt was there, they would be put in there. Recently, in Malayalam Manorama, there is a column called Rajagopal. In that, Salim Kumar, the actor, had written a short piece. She says, when I was in the ICU, I saw people to my right and left dropping like flies and dying. And then I thought, that's all our lives are about. Something to end in an intensive care unit someday. And I was shocked, not because of the whole thing that he said, but he has taken it for granted that death in the ICU is the norm. And that transition of not only healthcare professionals thinking it their duty, but the person on the street also believing that death should be in the ICU, that is a sad fact that causes suffering. When my time comes, Geeta, please remember that if you are treating me, most important thing for me is to be comfortable and at peace. Physically, emotionally, socially, spiritually. And if I am to be at peace, I have to go with the thought. I don't want to go with the thought, oh my God, now I have destroyed my family and the next generation also. End of life care should be humane. So what would I want? I would want my pain treated. Sometimes we take things very philosophically, say, well, we can overcome pain with inner strength, spiritual strength, etc. Okay, I have been doing this for some 30 odd years. I've treated religious elders from all three common religions. I've still not seen the person who has conquered suffering. I don't know if you have heard about Ramana Maharshi, who was operated on appendicitis. This was not so long back. And the famous surgeon Somerville was operating, and he offered anesthesia. Those were the early days of surgical anesthesia. Ramana Maharshi refused. He said, no anesthesia. And during surgery, Somerville asked, don't you have pain? He had dissociated himself from the pain. Great, fantastic. But later on, Ramana Maharshi had cancer. He had 3 operations, and after the 3rd, he had a recurrence. Towards the end, he would still be heard groaning and crying through the night. There is a limit to which you can dissociate your mind. Pain occupies the whole mind space, leaving no space for anything else. And repeatedly what families say in distress is, this is not our loving mother. She used to be so full of love and now she doesn't care even for the children. It changes people. So relieving pain or breathlessness, some frightening symptoms is very important. Unfortunately, in my days, neither me or in your generation, you were not taught to treat pain. That has come into the curriculum only now. We waited a long time in India. But that's what palliative care training is for. I would want stopping all needless procedures. Oh, every day doing blood sample, arterial blood gases and electrolyte concentration. My God, he's not going to check it when I get there. He won't ask for the reports. What's the point? Concentrate on well-being. An Australian psychologist, famous person, Eric Castle, said, it is persons that suffer, not bodies. All our education has been about bodies, chemistry, organs, tumors, microbes. We forgot the person. So, at that time, please stop all those needless investigations. Very common. People still can't hardly swallow, and instead of a few grains of rice, which they want, what they get are capsules, because the big doctor has prescribed it. They still have the statins going in to treat cholesterol. Oh my God, what's the point? And we often are not able to stop it, because if they talk to the specialist, they will say, no, that should be continued. And invasive procedures, as much as possible, have to be avoided. Parthasarathy Shom was the former financial advisor to Prime Minister of India. And he wrote this piece in the Business Standard after his mother's death. He writes a whole article in which he says he had never heard about palliative care. Only his mother's experience made him learn more. So among what he writes, he says, even on the day of passing, a specialist recommended a liver function procedure. When asked if it would end the coma, the answer was in the negative. So then why are you doing it? And the doctor said, we have the ethical responsibility to keep trying. Keep trying to do what? Some things may still have to be done. I am not saying that all medical management can be stopped. If I am coughing away to glory and cannot even breathe properly, I may still need antibiotics. But I would avoid hospitalizations if possible, but that may still be necessary for comfort, but especially ICU. Surgery only if needed for pain relief in the last phase of life, or radiation, or chemo. Sometimes even in the last month, you may want a single fraction radiation, because there may be sometimes no other way in which pain can be relieved. But the point is, it's for well-being. And no tubes, unless a tube is already in place, you may decide to continue it. But women find it harder to accept it. Generally, I'm generalizing, there are always differences. Harder when a loved one doesn't eat anymore. They are generally used to feeding people all their lives. And when a loved one cannot, but he's not eating at all. And that causes force feeding. And force feeding is one thing that is totally sure to destroy appetite. If not, if you just feed 2 spoonfuls, they may still have something. So this causes insertion of a tube. It had happened to my professor only a year before last. She had dementia. She had been living with dementia for 7 years. A miserable existence. But at this stage, the children streamed in from all over the world. And unfortunately for her, she had 7 children, 6 were doctors. And predictably, the other daughter said, leave her alone. But the doctors could not, because they were loving, you see, it is out of love. So they forced a tube in for feeding. Naturally, she would pull it out. So what would you do? Hands and feet tied. And she had managed those 7 years without a pressure sore. Then she had pressure sores. Obviously painful, because then she started crying more and screaming. What a horrible fate. So, this is for everybody, not only for healthcare professionals. One of the things that many people face is when a special friend is close to death, the reactions are on you avoid going there. You can't see the pain. You don't know what to say. And then if you decide to go, you go and say a few meaningless things. But the greatest trauma that you can cause is by recommending treatment. Unfortunately, that is very, very, very common. You love the person, so you want to do something. I know, the doctor said all that, but there is this doctor in Mumbai, and he's a wonder person. He can really save lives. It's only a flight away. Why don't we take them by? And then it goes down to somebody in Wayanad doing herbal medicine, and Rishikesh, somebody. And the family is torn between so many advices, and sometimes I recommended that you did not do it. This blame game starts, and sometimes people get very angry if their advice is not followed. That's a real cause for suffering. If I am lying there in my last month, please do visit my friends. You don't have to make speeches. Please don't ask unnecessary questions either. Just come and sit there. I may want to speak. Silence can be a powerful therapeutic tool if you just sit there for 2 minutes. Sometimes if I feel like talking, I may want to talk. And one of the best things that happen is I may tell you things that I have never told anybody else. It may be things from my childhood, something that I wish to do, a pleasant memory, a bad memory, something that is pent up there will come out, and that itself is a great thing. And what would you say? The person feels guilty. I wish I had not picked up that quarrel with my brother. Why did I do it? It was just over a few cents of property. Why did I do this? So what would you say? Very often we say meaningless things. There is no need to feel guilty. You had right on your side. You were right. He was wrong. My God, that's not the point at all. The point is he wants to see the brother again. He wants to make peace. If you can be that ambassador, that would be a great help. Listen to the story without judging and do what you can. But certainly, well, I see that you are feeling very guilty about it. Though it's not your fault, you are still feeling guilty. Would you like me to help? Can I call him? Or can I go and see him and talk to him? And if you cause one hug between those two brothers, that would be the greatest end of life care. In the Chittaranjan Cancer Institute, and they had brought this man because they wanted to see me communicating the bad news, that incurability. And through our process, we don't do that in a hurry. We listen, we tell him. And eventually when I had communicated to him, he sat there in silence for a minute and said, I have educated 17 children. Who, after his retirement, with a little bit of pension after his wife died, whatever he earned, most of it he spent on educating children. Why did he tell me that? I waited thinking that he wants somebody to take over it. And then he said, no, it's all taken care of. As I was getting old, I have found donors for all of them. Why was he saying that? He wanted to be acknowledged as a human being with his virtues and his values and his achievements. And from the heart, what you feel you can show. This is not a small thing. Very few human beings would have achieved that, building 17 lives. And at that point, that acknowledgement can be the greatest form of spiritual care. For the person, it may be reading the holy book also, but not for everybody. I actually know a person who whispered to me, can you ask them to get out of here? I can't stand the noise. People are different. People's needs are different. And unless we understand the person and hear his story, you won't be doing the right thing at all. And sometimes they don't talk. Sometimes it's good to be there. Just be there, because the person is reflecting on things. And a company, unless he indicates that I want to be alone, sometimes they say that because they are afraid to cry. They would say, I want to be alone. That's fine. If not, maybe just sitting there in peace is so much better than talking meaningless things. Most importantly, please keep me connected to my world, if at all possible. One of my colleagues who lives with a major disability says one of the most important things for her was the tree that she could see out of her window. She is a wheelchair user and has very little life outside of her room and office. And a tree, when it was cut down, a good part of her world was lost. And she, being moved to a place where she can watch the trees, was so very important, because about 25% of her world was lost with the cutting down of one tree. Keep them connected as much as possible. What connects people can be widely variable. A lot of people are connected to their religious beliefs, to God, and they need that support. But many others may be connected more to both the acknowledgement about the environment or to the loved ones. It can be very different. Would you like to take a moment to think? What's the answer to that question for yourself? These are all common answers often coming. We try to make it happen as much as possible. Not everybody is connected deeply to home. Somebody who has been moving around the whole country on transferable jobs have only that much of connection to a particular home or a particular place, but whatever that is, religion, vitally important for many people, but not for everybody. Some people are so connected with their occupation that when they cannot do that anymore, they totally feel disconnected. And for them to do something, if you can find something meaningful to do, that is phenomenal. I had one patient whose most of the time after retirement was spent in copying Bhagavad Gita. What's the point with all the Xerox machines and phones now with you? Why write it down? But that was what was so important. And when she could not have steadiness of hand, what's the point? Why should I stay alive? I'm not of any use to anybody. That's what she went on saying. And the daughter kept on saying, a doctor said, Mom, you were useful all your life. You brought us up. You don't have to be useful anymore. How do you like that answer? The daughter is validating what she said. You're of no use. Yes. You had a better life. Instead of that, if I couldn't make it happen, if somebody offered to write for her the Bhagavad Gita just for a few minutes every day, what a difference it would have made. But that family couldn't see the point. Whatever it is, the point that people get connected to sometimes can come only when they tell you their stories. 2 years, only one tongue. So we listen twice as much as we talk. Finishing unfinished business is very important. Making a will, sometimes very important for somebody. Even the last few days, somehow they want to do it. And the daughter's marriage is in September. And I want to be there. Well, after a couple of conversations, the marriage is brought forward. Okay. Some plans changed. But the man got to see the wedding. Those are important things for people. Talking to that brother with whom the man quarreled and making a reconciliation, and if they can hug and cry together for some time, my God, what a relief. But certainly we'll make the family present whenever possible. And if there is nobody at all, that happens. If somebody who has come to Kerala as a child, broke all connections with the extended family in Himachal Pradesh, there are people like that. We had one Britisher dying with us fairly recently. No connections, no family connections. Well, then you become family. Somehow establish a relationship that the person values. Then at that point of time I will feel, okay, somebody cares for me. We had a man who came cursing God all the time. എന്ത് ദൈവം? ദൈവവുമില്ല, ഒന്നുമില്ല. എന്ത് ദൈവം എന്നോട് ഇത് ചെയ്യും? ഞാൻ എന്തെങ്കിലും ആരെങ്കിലും ഉപദ്രവിച്ചിട്ടുണ്ടോ? ഞാൻ എന്തെല്ലാം നല്ല കാര്യങ്ങൾ ചെയ്തിട്ടുണ്ട്? എന്നോട് ഇത് ചെയ്തിരിക്കുന്നു. ദൈവം പോലും, ഒരു ദൈവവുമില്ല. We did not preach to him. We did not shout God down his throat. അയ്യോ അങ്ങനെ പറയില്ലേ, അത് വലിയ പാവമാണെന്നൊന്നും ഞങ്ങൾ പറഞ്ഞില്ല. പക്ഷേ 3-ാം ദിവസം ഞങ്ങളുടെ ഒരു നഴ്സിൻ്റെ കൈ പിടിച്ച് ഇങ്ങനെ മുഖത്തോട് ചേർത്തിട്ട് അയാൾ പറഞ്ഞു, മോളെ, ദൈവമില്ല എന്ന് ഞാൻ വിചാരിച്ചത് തെറ്റായിരുന്നു. ദൈവമുണ്ട്, ദൈവമാണ് നിന്നെ എൻ്റെ അടുത്തോട്ട് അയച്ചത്. She made God present for her. And that is something that any human being can do without judging the person. And particularly, if you know a child who is thrust into the role of a caregiver, that is one of the most painful things. Everybody, we doctors take it for granted. Give her the child instructions, like this child. And they need special attention, they need love. If at all we can get a paid caregiver for that person and share some other responsibility, that would be wonderful. Sindhu is a friend of mine. She became a friend of mine after writing this article. She is a writer. She writes, my 84-year-old father, my best friend, was enduring raw, intrusive medical procedures against his own wish. All skin and bones, he looked defenseless and at the mercy of doctors, his arms tied up, vulnerable and agonized. That article is still available on the Hindu site. And for anyone who wants, I can share this presentation. You can read the article. Very moving, touching article. She also finally heard about palliative care and talked to somebody. And she went to the hospital and told her the dad. And one of her problems was, she writes in the article, I wanted to take him home, but how could I? The doctors have broken him up into segments, which only they could put back together. ഹാർട്ടും കിഡ്നിയും ഒക്കെ വേറെ വേറെ ആളുകളുടെ കയ്യിലല്ലേ ഇരിക്കുന്നത്. ഇവരിതെങ്ങനെ കൂട്ടിച്ചേർത്ത് കൊണ്ടുപോകും എന്നാണ് അവർ ചോദിക്കുന്നത്. Then she heard about palliative care and went and told Dad, tomorrow morning I'll take you away from here. Because she couldn't go through the formalities like giving, only when the consultant doctor came it was possible, etc. Unfortunately, she writes, the father died early in the next morning before she could get there. And all her pain is made visible through that article. And unfortunately, we, the medical system, becomes party to that kind of crime. This, the National Cancer Grid is a collaborative of cancer hospitals, including at least 5 hospitals in Kochi. And they say, do not treat patients with advanced metastatic cancer in ICU unless there is an acutely reversible event. And you could translate that to dementia or any incurable illness. Better please be clear about it, because you may use this argument in a conversation with the doctor. Inevitably, the question comes, if we withdraw life support measures, will that be euthanasia? I can almost see the question wandering around there. And by the official definition in India of ICMR and by universal consensus, it is not. If you withdraw a ventilator that is not killing, you are only allowing natural death. Euthanasia is killing, however noble be the intention. So we are not talking about that. India, I believe, is not ready to discuss euthanasia, though that question comes up, because if I come to you or you, Sudha, in agonizing pain and ask to be killed, would you rather say, oh, come on and lie down, let me kill you? Or would you find out about my pain and treat my pain? So, in any country which has legalized euthanasia, including the several European countries and Switzerland, which is now starting to have euthanasia tourism. You can drive over from other European countries and die in peace there. You need a bit of money. But Canada legalized euthanasia, some states in USA. So wherever they have legalized it, they have first made palliative care available. Canada in 2018 passed 2 laws. The first law to be passed made palliative care a right, human right. The second one was to permit euthanasia. So you have to take away the suffering before you think of euthanasia, and that's why I believe we are not ready to discuss it. As of today, euthanasia is murder. This is one thing that I would strongly recommend, something that I have done myself. I have written my advanced medical directive. In our Parliamentary website, this document is there, and it includes the form, parliamentary.org. If you go, you will find it. Last year, in January 2023, the Supreme Court had a 5-member bench deciding on this, and they have previous Supreme Court had also validated it, but this was more emphatic and better termed. I have signed my document. If my wife or my children are not available, I have acknowledged 2 attorneys. Attorney is not necessarily a lawyer, to take decisions on my behalf if I am unable to take decisions. I have got it witnessed by 2 people and got it countersigned by a gazetted officer. And Dr. Sudha, you have a responsibility to abide by my wishes. Legally now. There is no law, but in the absence of law, a Supreme Court judgment holds valid. They have put in a few impractical procedures also. If you have started something, it's a bit difficult to withdraw it now in the hospital. You have to somehow escape from the hospital. Otherwise, not possible. Not possible, it will take a few days. One primary medical board can be involved immediately. In the hospital, you name about 5 people to be available, so that at least 3 will be available. 3 will have to get together. The primary medical board will have to consent, give the concurrence. Then we have to inform the DMO, and a secondary medical board has to be formed. Actually, this can be, once routinized, this can be easy with a phone call, but till it is routinized, it's going to be difficult. Which is why I asked Chandrika to take me away before some life-saving intervention is established. So, my strong recommendation, you can do it when you are healthy. Create a document. The form is given in the website. Get it countersigned by a gazetted officer or notary public. One of them is enough. Keep a copy of it with your medical records. But most important part, make sure that your loved one's family is agreeable. Because doctors are sensible enough to know that I will not take the matter to the court after I am dead. Living family members will go to the court. So the family has to agree. That's the most important part of creating a living will. A Lancet Commission report said one of the most important things that are necessary is for what they call death literacy. Not only for healthcare providers, but everybody will have to learn more about death and dying, because now people are death illiterate. Death illiteracy is a big barrier. Doctors feeling, a new generation of doctors feeling that they have a duty to stretch out the dying process, another problem. Of course, a lot of family and societal pressures. I'm sure you must have had hundreds of experience of you deciding against it and the family coming and forcing you to do things. The legal status, there is no law, but fortunately the Supreme Court order is there, and that is, except about that withdrawal I support, that is facilitatory. What we all can do also is to make sure that conversations around death happen. In the Western countries, they have started a movement called death cafes. 3 or 4 people get together, start to go to a cafeteria and start talking about death. What they say is, inevitably, somebody from the next table will come. I heard what you are saying. Can I join you? And gradually the group swells. But whatever be the methodology, conversations about death are necessary for our well-being at a critical time.